Can you hear me now? Yes! I hate the voice of the mic, so okay, so our group presentation is the frontiers in health and medicine.
So we did theme 7, it's health and medicine as frontiers. The umbrella question was, what are the physical and ethical boundaries to the frontiers of health and medicine? So what did we do to address the question? Our group communicated with what ethical topics we could explore in the parameters of the theme. Upon discussing and collaborating ideas, a question we came up with truly made us recognize a physical and ethical issue our country is facing. Our question was, is it ethical society promotes sick care before actual health care? In other words, should we get sick before we get better? Or should we get better before we get sick? To clarify a little more, I'm going to go into what sick care and health care is. There is a difference between sick care and health care. Sick care is what we know today as health care. It's the treatment of illness and disease rather than the promotion of good health. Health care is the creation of conditions to make it possible for people to take care of themselves. Countless medical conditions such as type 2 diabetes, certain cancers, and heart disease and obesity could be prevented as well.
So with all these different diseases, you would kind of think that everybody should have health insurance, but they don't. So I know health is boring, health is whatever. So everybody stand up, up. It's been a long presentation. Come on, just get up, stretch. There you go. Really. There you go. Blood. All right, now everybody sit down. Okay. I need 20 volunteers just to stand up. Just to stand up. So I got 1. Okay. 4. 5. Stand up. Standing up. All right. Raise your hand. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. Get up. I see you. 17. Oh my God. 18, 19, and the big beard. Don't get so happy. You're all sick. Don't get so happy. You're all sick. Hold up. You see these 3 people in these 3 rows? The first row? Yeah. They don't have health insurance. These 3 people. You see those 3 people over there? They have mediocre. They don't know if they're gonna be good insurance, not good insurance. They don't know how much coverage they're getting. And guess what? A fourth of you, meaning all of you over there, you don't even know if you're gonna get any good insurance. 1/3 of the whole American population, they don't know if they're gonna have good insurance. Sit down. So just think. Alright, calm down. So out of 20 people, 3 people don't have health insurance. What are you gonna do? 3 people have inadequate. What are you gonna do? 6 people, they don't even know if they're gonna have good insurance or not. Think about that. In 2012, you can see that about 15%, which is 48 million people, they didn't have any health insurance. 12% because that's 38 million, had inadequate. And through all those people, which is 313 million people in the United States, 61% didn't have health insurance because they could not pay. That's sad. And that's all because of poverty.
And so sad, as she said, that we in America people don't really have enough insurance. So we question, why do people don't have enough money to get their insurance? In fact, after we do all the research, we figured out that because of poverty, that prevent people to get their insurance. In 2013, 45 million people live in poverty. That is 1/4 of the population of Bergen. So our 4 people and 1 people are equal. So in fact, poverty can create inequality between the social class in the US. First, low-income students need to go to school that have fewer facilities and have less teachers that have high quality or lower funds. So that is an example of education inequalities. Besides that, there are not gap between the student. If a student don't know that alcohol or tobacco is harm for them, they're gonna start using these harmful products when they were young and get addicted to, and there's no way to get out of it. That brings us to another issue called the health inequality. So people, the life expectancy of people is reduced when they use the harmful product. Like chicken or cow, they use a different technique to raise them. They feed cow with corn that can create E. coli bacteria that can harm children when they eat them. So people, they also wait until they have health crisis to go to emergency room, and it's gonna cost them a lot of money. And as a result of consuming a lot of unhealthy food, the number of people that have obesity increased, and we're gonna talk about obesity now.
Poor Americans have unique obstacles to developing healthful behaviors. Poverty, which goes hand in hand with lack of nutritional education and food insecurity, is a leading cause of preventable childhood obesity. 1 in 6 American children is obese. Children from poor households are twice as likely to be obese as children from high-income homes. Yet, for low-income people who do have health care, access to preventative care is still extremely limited. CHIP, which is Medicaid's health coverage program for low-income children, focuses on medical intervention for chronic diseases after a child has already become obese, rather than prevention through education and greater access to resources.
So, the prevalence of obesity has doubled in America over the 4 decades, and this is as a result of a healthy lifestyle that people have adopted over the years. And as an effect of this, we have various diseases spreading across the United States, such as diabetes, which is the 7th leading cause of death in the United States, hypertension. 71% of high blood pressure is actually related to diabetes and obesity in the United States. Some other, medical conditions are kidney diseases. About 44% of kidney disease is caused by obesity and diabetes. Heart attacks. Actually, hospitalization rate has increased over the last 4 decades, up to about 1.8 times as compared to what it was before. Stroke has also increased to about 1.5 times what it has been in the last 4 decades. All of these health conditions and problems, what they do to our body is that they expose the body, to other medical conditions which can actually be terminal or curable depending on what the disease is.
Go on, Andrew.
Thank you, guys. But we stated a lot of issues, but we have solutions. So, to begin off, we have an idea we came up with is the Parent and Child Olympics. So basically, it's a day where parents and children can come to the school and they can do activities together. They learn how to work as a team, and they learn that you can be physically active and have fun.
Yeah. Fun.
Another solution we came up with are bringing farmer markets to local communities, colleges or schools, or rec centers, because low-income areas, they don't usually have healthy food options. So if we bring it to a local community college, they could go there, buy what they need for their families, and have better options, so they can live healthier lives.
So one of the solutions that we actually found as well is to educate parents. But why parents are actually so important in this topic of health? It's actually because right now their children is actually the future of this country. So everybody who is a parent right now, we could actually educate them so their children can have a better eating habit in the future. So what we're trying to do is encourage families to attend to health seminars where they can actually learn
from a healthcare team about a variety of health dishes options that they can add to their diets. Because like nowadays, most of the people what they do is just to buy fast food instead of just buying something actually like vegetables or fruits that they can always eat in the house, but they actually prefer to waste money outside. So the objective of these seminars that we are trying to put the parents to is to make parents aware of the children's nutrition, and so they can substitute unhealthy fast food for vegetables and fresh fruits. Thank you.
So the impact we hope to have through our awareness campaign as well as the events that we host is we hope to provide the foundation and the push that families need to get started on the track to a healthy lifestyle. A healthy lifestyle will make it so much easier for families to keep themselves healthy, because it's so much cheaper to stay healthy to begin with than to intervene once you're not.
This subject is highly personal to our group. I was a super morbidly obese teenager from a very poor family. At over 500 pounds, I was diagnosed with type 2 diabetes that left me in a coma with heart, liver, and kidney failure. Medical intervention obviously saved my life, and I'm here, but adequate preventative care, awareness, and better access to resources would have resulted in my life not being at risk in the first place. So the good news is that through preventative measures, we can all work to ensure that our children and their families are empowered to make healthiness their way of life, no matter what their income levels.